Can stress really break your heart? You know, when you get that chest tightening feeling, and sometimes it can even lead to not being able to breathe, and you think, am I having a heart attack? But it might be something else, which could be the stress-induced cardiomyopathy. So this is what I want to talk to you about in this video. So hi, I am Paul Saran. I work in a cardiac OR, and I am here to keep your heart beating nice and strong. So like, share, and follow if your heart's into it. Stress-induced cardiomyopathy is also called the broken heart syndrome, and it happens after a very intense emotional or physical stress. It could be grief, it could be a loss, it could be even a surgery or something really dramatic, anything very intense that is prolonged. So when that happens, your body is flooded with adrenaline and cortisol, which stuns the heart muscle and it makes it pump poorly, especially the left ventricle. So the symptoms kind of looks like a heart attack. So we're talking about sudden chest pain, shortness of breath, palpitation, dizziness, and sometimes it may even go to fainting. Even the troponin levels may rise. And this is something that usually signals that your heart has some damages in it. So it's done by a blood test. But here's the twist though. When you go to emergency and the doctors look inside your arteries, there's often no major plaque or blockages. This is totally stress taking a toll on your heart muscle. If this happens, you need to go to the ER immediately because it cannot be diagnosed without these tests such as EKG, echocardiogram, troponin levels, and sometimes they might even do a coronary angiogram to rule out the blockages. So the treatments when this happens usually includes medication to reduce the heart workload, such as the beta blockers, and it helps also to manage the stress that caused it at the first place, right? So most people fully recover within a few days or a few weeks. This situation is a very powerful reminder that our emotions do matter to our heart and our heart health. I hope this was informative and it helps you understand your heart a little bit better. I'm going to say, I know you've got this. Until the next one, Tolu.